Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. If you missed our live show, it is only available on our YouTube channel. What a fantastic conversation we had with Director 4 David Muntz, Sue Shade, around what's next in health IT. You can view it on our website with our new menu item, appropriately named Live, or just jump over to the YouTube channel. And while you're at it, you might as well subscribe to our YouTube channel and click on Get Notifications to get access to a bunch of content only available on our YouTube channel. Live will be a new monthly feature only available on YouTube. How many times did I say YouTube in that paragraph? Subscribe to YouTube. We're going to have some great stuff over there. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show. All right, today's conversation is with Patrick Potter with a cool title of Digital Risk Strategist with RSA. Good morning, Patrick, and welcome to the show.
Good morning, Bill. Nice to be with you.
I'm looking forward to this conversation. We've had a lot of different conversations around security. I like RSA as a company. I've used them in the past, and I know that you guys go at it, really give me a different level of detail when we're talking about this. So I'm looking forward to it. But before we get going, tell us a little bit about RSA and your role with RSA.
Yeah, so I'm part of a small team of prior practitioners, consultants. You know, we've been in the trenches like our customers are, managing security and managing resiliency recovery, managing compliance, risk management, those sort of things. And so we are part of a subject matter expert team in our marketing organization that helps our customers, kind of think about how to differently manage those domains of risk and compliance and security.
Yeah, the whole thing really is about risk, and we've really increased the risk quotient. Whenever you move this quickly, you really do create just an awful lot of risk, either with new partners or new technologies and just new ways. So pre-COVID, we were seeing a significant amount of activity in cyber attacks against healthcare organizations, the most common being phishing and ransomware. What are some of the most common attack vectors today as the COVID-19 crisis continues?
Yeah, the phishing campaigns, ransomware is still number 1 and 2 and 1. There's been a lot more malicious smartphone apps, for example, trying to get people to download, the app, and then it delivers malware. There's a lot of new websites being spun up with, trying to get information out there to, around the pandemic and, funding and, stimulus act kind of information, trying to get people to click and then there's still a lot of, and there has been for a while, Bill, with the whole Internet of Medical Things, but quite a bit of insecure endpoints and end users, a lot of people working from home and, just basic hygiene, security hygiene, bad passwords and, insecure endpoints. And third parties are still, unfortunately, fortunately, they're a great partner for any organization, but unfortunately, they tend to bring risk for a lot of the same reasons I mentioned, because they're in the healthcare field. And then, like you said, believe it or not, bad actors are increasing their work during this pandemic, even against the healthcare industry.
Yeah, so let's talk about some of my favorite challenges that we were facing, and these were during normal times. And that is, we have all these third parties, these partners that we have to that we choose to partner with within healthcare that do a lot of things, call centers, billing, collections, other things, scheduling within healthcare. How do you, during this crisis, how do you extend the perimeter, if you will, to really protect not only your organization, but even moving employees to their homes? We've extended the perimeter, haven't we? And what are some best practices around that?
Well, like you said, it's all around risk management. it's all around, going after those attacks, finding those vulnerabilities, in those systems that are most critical to your organization. It's knowing where your most critical data is and protecting it. It's it's kind of going back to a lot of the basics where you're planning for those attacks, you're managing access up front, you're detecting those security attacks, understanding the impacts, right? Because you can't go after everything, and then responding to the areas that represent the most risk. So that's something we always teach and work with our customers on. Is just you can fight what's right in front of you, and sometimes you need to do that, but then it's also important to take a step back and get some good process in place, and it's never too late to do that.
Yeah, so it really is back to the basics. I'm gonna reveal a little bit here. I'm actually working off of I have to prepare somehow for these conversations, and one of the things I did is I pulled up a document, slide deck. I'll put it in the show notes. It's a really good document. It's a 4-step approach to mitigating cyber attack risk in healthcare, and you guys go through. And again, it's probably not anything new for organizations, because security isn't anything new. It really is good process, good hygiene, good training. It's understanding your risk profile. It's the same things, but it's really solidifying your processes, your procedures, your people around it to make sure that you're carrying that out at any given time. So you guys have a 4-step approach to mitigating risk. Talk a little bit about that with us.
Yeah, it's like you said, it's a good document. It's back to the basics. In fact, the steps I just mentioned to you are lined out in that document. So it goes through each of those 4. 1, planning for the attacks. 2, detecting security threats. 3, assessing the impacts, and then 4, responding to the risks. And it talks about how, for example, HIPAA, requires you covered entities to have policies related to breach response and notification, but really, policies need to go beyond that and talk about, fuller cyber incident response plans that include investigation, remediation, and response. And, when you're putting all this in place too, you've got to understand the organization's maturity and capabilities, what the risk tolerance is, because that varies by organization. That really should be, from the top down, and that risk tolerance should extend not just to security risks, but other risks as well. Because, think about, Bill, you being a CIO, you're weighing a lot of different things, risks alongside acquisitions, alongside new systems, alongside new products and services.
Yeah, I guess during the pandemic, it really was risk versus moving quickly to potentially save lives, right?
Exactly. Yeah, as an executive, you're weighing a lot of different things side by side. So, we try to get that good discipline in place, and a big part of that also I'll throw out there, and it's not in the ebook, but we talk a lot about, is cyber risk quantification, because a lot of times security teams don't translate the risk of security risks well into business terms, and executives need to know that so they can quickly translate that into, okay, you need $1 million, or I've got to take $1 million from over here to put toward that risk. So we really kind of say, hey, you've got to turn cyber risk into business value terms, so you can get the resources to do something about it.
So let's walk through these a little bit. Detect security threats. One of the things that changed in my life was I was sitting down with someone like your organization, and we were talking about this was back in the day. This was maybe 6 or 7 years ago, and we were talking about how strong our perimeter was, and someone like yourself made the point to me that says, you need to change your mindset and your thinking as how you approach this, and really just assume they're already on the wire and start to create your security processes around that. So how has detecting security threats changed over the years as we start to think of I mean, at one point we were build that wall higher, 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 stronger, deeper. And now we're looking at all sorts of new things to really provide visibility into the threats.
You just hit on the word visibility, and I think you get that through, being in the right place at the right time, purposefully, but then through advanced analytics, I think is really, a key tool that you've got to have in place. So you've got to be, looking across your logs, your network, your medical devices, your endpoints, gateways, so that, you're looking across that whole, battlefield, right? And you hit the nail on the head. You've got to assume that they're already in there. So, how do you rapidly detect where they are? Well, you do that through that analytics. And so we work with customers around implementing, user and entity behavior analytics, which, in the ebook there. But that's to detect those anomalies that are already there, you just haven't picked up on yet. And that's oftentimes in the user's behavior, for example. And that allows you to kind of uncover those abnormalities and to do something about them. But then you weigh those against, your business context, right? So what are they hitting? What's the exposure? What's the impact? Is it a critical system or not? Because you're going to take different action, and then that kicks off your incident management against those, those bad elements. And then, you can automate a lot of that through orchestration. Orchestrate and automate that so that your analysts are, there's a weeding out process right through that automation, and then your analysts can really focus on what's most important.
Yeah, the incident response is interesting to me because I was an interim CIO for I think about 3 weeks before we had our first breach, and that taught me that either assess before you take the job, assess the security posture, or the day you get in, assess the security posture. Because 3 weeks in, that really wasn't laid at my feet, but it could have been from the fact of I was there for 3 weeks. I probably should have done a little bit more, but essentially, you get 3 weeks in, you have your first response, and we kick off a full-blown incident response from an IT perspective. All projects really almost shut down. Everybody's involved. We're trying to determine things and whatnot. But I was also involved in other things where people said, well, we need to kick off incident response. And I just looked at it and I'm like, not for this. I mean, this is, this is like, just flip that switch and do this and notify these people and have these conversations and we're good to go. Is that something you do with policy ahead of time, or is that something that every incident is really different?
No, I think you have to set some guardrails for sure, and you do that through policy. Like you said, you do that through, some sort of impact analysis. So if, for you business continuity folks out there, the exercise of a business impact analysis that helps you determine what's critical in the organization in terms of the business processes and the systems that support them. So that gives you an element of high, medium, low, or however you assess that criticality. So, you bounce that off against your policy bill, and then okay, this is against a high criticality system or data set. So we do need to kick off incident response. And as you activate those processes, and it kicks people into motion and takes resources and time. So I think those are two important elements. Set up that program so everybody, and then you've got roles and responsibilities depending on who and what they need to do, and again that the criticality. And then you can also set up different, and really should think about different response types, right? Depending on what the issue is. So yeah, I think you set up some process ahead of time. So and then there's always the human element. There's always that human judgment based on what is going on. But then you overlay that on top of the policy, the automation, the standard practice procedures, and it just cuts down so much on that chaos.
Yeah, I'm. Again, I'm looking at this thing, and you have a self-assessment actually on this document, riskassessment.rsa.com. And so it's an online tool to really take a look at, how you stack up, I guess. with regard to some of these risks. I mean, can you speak to the tool at all, or?
Yeah, I mean it's a little bit higher level, but I think it is a great tool just to see. It goes through areas of risk. It talks about security. It talks about kind of some of the basic blocking and tackling.
Yeah, breach preparedness, breach deflection, breach incident response, remediation, post breach. I think this actually is a really good tool for people who are wondering is, where do we stand? Do we have these things in place? I remember when we had a chief information security officer, and then we finally decided to really go in and go all in. And we hired a chief security officer, which became the peer of the CIO. And that person brought in a complete framework. And I remember the first time after he got done doing his assessment, he had 12 pillars and he sort of ranked us. And I looked at the pillars and I thought, you're not going to share that with anyone, are you? I mean, we're on some of these things, because if there's 12 pillars, you can't be it was a 1 to 5 scale. You can't be a 5 on all of them, because you just again, it's based on risk and the risk you're willing to accept. You can't spend that much money to be a 5 on all of them.
Maybe you shouldn't. Maybe you shouldn't. Maybe you can, but maybe you should not. Just because, hey, we've got limited resources. We've got to do it elsewhere. Maybe we don't need the absolute Mercedes version of this step, but maybe step 3 we do. So take some judgment there, even with a maturity model.
Well, and it was interesting because Sam then went to the board meeting and we co-presented, and Sam really walked them through, because they looked at it and were horrified by it the same way I was. And he walked them through and said, look, most healthcare organizations are typically hang out at a 3 for this and at a 2 for this. They strive for a 4 here. And so we sort of set our goals for each one of these things. And then we came back with a plan to move each dial up by 1 over the next year, or even move it up 2 based on how critical it was to move. For my audience, I'm going to give you a little license to talk about some things here. Because I do want you to share some of these things. You guys have a lot of different tools that people can use. You have, Net Witness platform, Secure ID Suite, a bunch of things are talked about in here. What kind of tools does RSA bring to the table on this?
Well, we really help customers, just manage the whole life cycle of security and risk, and do it in an integrated way. And that's one of the biggest challenges, I think, with companies, is the silos of organizations and approaches. Managing security and risk, they don't follow the same standards, and there's different groups and different teams that they're starting to merge together. And that's what we help do. So we really kind of help companies understand what we call the domains of risk, and focus on those, similar to an approach like you just lined out when you were CIO, that your CISO did. So some of the domains of risk are, of course, cybersecurity, cyber attacks, third-party risk, compliance, business resiliency, risk management, just in general, process automation. So there's 8 or 9 of these, and we sit down with customers and say, okay, let's evaluate where you are. Let's talk about this topic, and is it important to you or not? Another huge one right now, Bill, is dynamic workforce, with everybody sending people home to work. That's an element of area of risk all in and of itself. But then we kind of help them understand there are some disciplines and some processes to put in place. And then our tools and our services, our solutions and services map to those. So, for example, you mentioned Net Witness, right? That's a tool that enables companies to monitor, network activity, what's coming in from those endpoints and those packets and logs, and is it good or bad? And really, through automation, enables you to prioritize, exactly go through the process we talked about earlier, and focus in on those areas of risk that you need to address. And then Secure ID, which is super important right now, enables you to manage securing access up front for your employees, your contractors, your providers, your third parties, your payers, whoever is coming into your systems, especially important right now with electronic health records and the whole Cures Act and interoperability. Because access is going to be an issue across those data sets that are being shared more and more. So, and then Archer, we've got a governance, risk, and compliance tool that helps you put in those risk processes and manage these different areas of risk. And I could talk for hours on each one of those.
Yeah. So let's end the show where we started, which is specifically around COVID-19, the pandemic, and things that are going on. And so work from home. I'm just going to walk through some of these. So work from home, telehealth, remote patient monitoring, interoperability, big data analytics. These are some of the things that have really boomed in the last, 3 months or so, and potentially have created just new avenues for people to attack healthcare organizations or just new vulnerabilities, right? So work from home, some of the risks from work from home, from my understanding, are I'm on this computer. This computer is technically not part of the company network, and I have a router in the house. I'm going across the Comcast network, and I have to figure out some way to secure from one end to the other. I mean, what kind of things are you seeing people do, or what kind of things are you talking to your clients about?
Well, the first thing is just securing. Kind of goes back to that basic good hygiene. So if you send someone home and you've got to get them a corporate PC as soon as possible, right? Because those follow the configuration standards of your company. Another one is logging in through the VPN. Using that mechanism. Securing their Wi-Fi is another. A third is that secure ID, right? So having through that VPN mechanism, having a way to log in securely to your corporate assets, your systems and data. And then I think once all that's got to be quickly in place. I think that's the basic blocking and tackling. And then you've got to think about your help desk too. Are they equipped to handle the calls? The calls for help, because that's if I'm an employee and it's the first time I've gone home to work and something doesn't work, I'm not going to call Verizon or Comcast. I'm probably going to call my help desk at work. So they've got to be scaled up, and they've got to have the policies and procedures ready to answer questions and address those issues. So they need to understand not only the system issues, but the communication issues and the security issues as well, and then have quickly be able to, address those. You can't send someone out to their house, so you've got to be able to help themselves over Zoom or whatever mechanism you can. So I think those are some of the basics that you've got to have in place right now.
I'll tell you, you're giving me nightmares, Patrick. I started my career on a help desk, and it was a company that sold computers to home users. And so this was back in the day. I mean, as they say, back in 1990. And the first thing we had to do is we had to determine everything, right? What computer do you have? What processor are they? Remember back then it was 286, 386. We had to determine, and some of the calls are just hysterical. It literally people saying to me, that the coffee holder is stuck. It won't go back in. I'm like, that's not a coffee cup holder. That's for,
disk drive.
A disk drive. But that's hard in this situation. I mean, because we did send a lot of people home and we just said, hey, use what you have. But you're saying, hey, we should go back and just practice the same hygiene we would if they were working from the office. We've got to secure that from one end to the other.
Yeah, as much as you can, and this is probably not an overnight thing. I mean, they could be working from home for a while, and with healthcare, you've got HIPAA considerations too, right? So if you've got a telemedicine, like I met with a doctor the other day on Zoom, and what if I'd been in wouldn't have been in a Starbucks, but let's say telemedicine continues on, and maybe I am. There's some privacy considerations that if that provider is asking me questions over Zoom or on the phone,
Yeah.
It's more than security. It's compliance, and there's other considerations too.
Yeah, a lot of education, a lot of the ways we have done work will change as a result of this. If nothing else, it'll remain changed for the next 6 to 9 months. It might come back, but it may not. So it is time to shore this stuff up. Patrick, thanks again for your time. I really appreciate the conversation and looking at this important topic. My pleasure. Thanks for taking the time too. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email and let them know that you value and you are getting value out of the show. And also, don't forget to subscribe to our YouTube channel while you're at it. Please check back often as we will continue to drop shows until we get through this pandemic together. Thanks for listening. That's all for now.